We have tremendous employees here at Tri-City that work very hard every day. Example definitely is the NICU team and how much effort they've put forth to improve care. And our nurses are working the same to do epilepsy prevention in our adult population and our falls prevention team. These are all frontline staff that are working every day and doing everything they possibly can to improve care to make it safer in a very complex and difficult environment.
So I feel very fortunate and very lucky to work at an organization that not only supports a culture of safety, but actually looks at the nurses.
Everyone is diligent. We've done a whole culture change, which is really key to our success here.
In our hospital, we had really worked hard to try to reduce falls, and we tried everything that we had in our toolkit. And when I went to the Patient Safety Summit, I heard Dr. Dupree speak about this new TST tools and implemented the tool here at the hospital. We've seen a tremendous reduction in our falls, and it's a much safer environment. You know, we do daily huddles. We do patient safety symposiums. We do a lot of education out to the staff to make them aware how they can help us make things safer by talking to us.
And if we have an idea to improve, then they listen and they give us the support that we need.
We had a central line infection in a baby, Isaiah, 2010 that was. We determined it was probably because the dressing was changed, but not in a sterile fashion. Said, you know what, this has to end. We want 0 infections for our babies, for our patients. I went to the manager, went to the lead physician, Dr. Movahidian, and just said, we need to take this over. Is that okay with you guys? We're gonna start training and set up a whole process, get systems in place, including checklists, etc., to just revamp the whole process. And they were totally supportive and allowed us to do that.
Being 6 years free of a central line infection is unheard of. We went to an international conference, and the feedback we got from nurses across the world was amazing. They all wanted to hear our process and hear how on earth did you do that.
One of the most important things to make care safer is to reduce variability. So not having multiple people do different approaches to the same thing.
To place a central line, we all make sure that we're doing it the exact same way, so that way we know that we're not going to break the process.
It is kind of like a factory because you have to have the basics down. But any one of those steps might have a little hiccup that you have to be able to think through and react to and fix on the spot.
I think one of the most important things that we do is that we're continuously educating staff about the importance of reporting near misses or close calls.
So if we see something that we know is not right, that is not part of our process, I don't believe any nurses are afraid to stop what's happening. Some of the challenges that we've heard when we've tried to introduce it is, oh, that won't work. Oh, the nurses will never do that. It's not a choice for us. It's not an option. It's 100% what's best for the patient, and the system that we have is working.